Hi class. Today we are going to talk about head, neck and eye muscles. So if you look at the lab hit list for unit 4, it talks about the muscle names that you need to know on models, and also it talks about the origin, insertion and action of each muscle. Now what do you need to know for lecture and what do you need to know for lab? For lab testing purpose, which will be online for unit 4, you are only required to ID the muscles. So you will see model pictures and I'll ask you ID this muscle, ID that muscle. So only muscle names for lab testing purpose. And for lecture, you will be questioned on the origin, insertion and action of each of these individual muscles. So you are responsible for memorizing the origin, insertion and action of all the muscles for your lecture exam 4. However, I want to remind you that from now on, we are moving to mini quizzes for lab instead of having a lab practical exam. Therefore, next Monday, you will have a lab quiz on head, neck and eye muscles. I will upload the quiz on Canvas and I think it's worth 17 points. And you will look at pictures and I'll say ID this, ID that. It's all multiple choice and you will complete that quiz on Monday next week. Okay. And talking about these muscle, origin, insertion and action, I have put everything on the PowerPoint and it's pretty much your responsibility to memorize these because these are just plain memorization. I'll go over the PowerPoint. My lecture might be a little boring because it's the same thing as we put on the PowerPoint. So nothing I don't know. I don't find lecturing on these super interesting, but I'll just do it for you so it helps you for both lab and lecture. Okay? The first muscle we will talk about is called digastric. And digastric is a muscle that's found on the floor of your oral cavity. So right here, if you look at this picture, this is digastric. As you see, it has two bellies. Do you see that? It has two bellies. It originates from the mandible and mastoid process and inserts into the hyoid bone. So this is the hyoid bone. This is where the muscle inserts and originates from the mandible and from the mastoid process here. The digastric helps to elevate the hyoid bone and depress the mandible. So elevation of hyoid and depression of mandible, that's the function of the digastric muscle. Moving on to a flat muscle, and this is called Mylohyoid. This flat muscle right here, this is Mylohyoid. It originates from the mandible and inserts into the hyoid bone. So this is the point of insertion, hyoid bone, and it elevates the hyoid bone. The next muscle we will talk about is Sternocleidomastoid. Say it, Sternocleidomastoid. In this picture, you see Sternocleidomastoid in green color. Okay. Now, as the name suggests, this muscle originates from the sternum, and I will highlight the sternum for you. So this is the sternum and the clavicle. So it originates from the sternum and clavicle, as you see, and inserts into the mastoid process. Do you remember the mastoid process? It inserts there. That's why the name Sternocleidomastoid. If you look at one side, so each sternocleidomastoid muscle helps in head rotation, but when they work together, both sides, that helps us to flex our head. Okay. Then we are looking at a superficial neck muscle, and this muscle is called Sternohyoid, shown by the pink muscle, dark pink muscle on the picture. Sternohyoid, as the name suggests, it originates from the sternum, right here, originates from the sternum and inserts into the hyoid bone. So that's why the name Sternohyoid. It also depresses the hyoid bone. The next muscle is Rian, stop. The next muscle is Sternothyroid, and this is a deeper muscle. Now I want you to focus on the picture. Look, the green muscle is Sternohyoid. Okay, now if you reflect or dissect out the Sternohyoid, deep to that you see a yellow muscle and a brown muscle. Do you see that? So these two lies deep to Sternohyoid. So we are focusing on the yellow muscle called Sternothyroid. Remember, this is deep to Sternohyoid. And the name suggests it runs from the sternum to the thyroid cartilage. I'll just label the thyroid cartilage here. Sternothyroid. It runs from the sternum to the thyroid. Essentially, it should stop here, but the picture is not 100% right. So this muscle runs from the sternum to the thyroid cartilage, and that's why it's called Sternothyroid. It also depresses the hyoid cartilage. Then Tyro Hyoid, as the name suggests, this muscle runs from the thyroid cartilage to the hyoid. So this muscle right here is Tyro Hyoid. This also lies deep to Sternohyoid. This is Tyro Hyoid. Originates from the thyroid cartilage, inserts into the hyoid bone, and it depresses the hyoid bone and elevates the larynx. Alright, the next muscle is masseter. It's a big muscle. This is the muscle for mastication, and it elevates the mandible and closes the jaw while we chew things. Frontalis. This is part of the big muscle called epicranius. The frontalis, when it contracts, it raises your eyebrows and wrinkles the forehead. The next muscle is temporalis, which is located along the temporal bone, and the temporalis also elevates and retracts the mandible and helps us to close our jaw. The next muscle is Orbicularis Oculi, which is the circular muscle around your eye, and it helps us to close our eyes. This is our winking, blinking, squinting muscle. The next muscle is Orbicularis oris, which is the circular muscle around your mouth, and this helps us to make pucker mouth and also help us to kiss. The next muscle is Zygomaticus. Now I want you to know that there are two Zygomaticus muscles. There is a Zygomaticus major and a minor. For A and P class, we just go with Zygomaticus. On the practice set that I have posted on Canvas, it does point to both major and minor, and it'll ask you ID muscle. You should be able to tell me Zygomaticus. So I'll just tell you quickly. This muscle and this muscle. The white arrow is pointing to Zygomaticus major, and on top, this part is Zygomaticus minor. However, again, for A and P class, you need to know that it is just Zygomaticus. Okay, and this is your smiling muscle. Smile. Okay, as you smile, this muscle helps to raise the corner of our mouth. The next muscle is risorius. It also pulls the corner of the mouth posteriorly, as in smiling. And this muscle right here, pointed by the black arrow, this is risorius. Don't get confused between risorius and Zygomaticus. Risorius is this one. It runs very laterally. And Zygomaticus, oops, why can't I change color? And Zygomaticus are these muscles. So these are Zygomaticus, and risorius is the one shown in the black arrow. The next one is buccinator, and I don't think buccinator is on your hit list. Please do double check. Buccinator is a deep muscle And this is the sucking muscle. Babies have really well developed buccinator because they suck all the time. Then the next muscle is levator labii superioris, which is not the green muscle here, not the green muscle. I'm doing the red muscle that I'm highlighting. That is levator labii superioris. Okay, and this muscle, so the red muscle that I'm highlighting, that is levator labii superioris, not the green one, and this helps you to raise the lips as in snarling. Looking at some eye muscles, now we rotate the eyeball, right? And it's a very complex movement. And the extrinsic muscles, meaning the muscles that are outside the eyeball, helps us to rotate the eyeball. There are 6 extrinsic muscles that we will talk about. The first one is superior oblique, shown in the picture. This is your superior oblique muscle, and this rotates the eyeball superiorly and medially. Can you move? Can you look at your nose? When we try to point at the nose, that moves the eyeball medially. Then we have inferior rectus right here. The inferior rectus rotates the eyeball inferiorly and medially. Then we have medial rectus, which is this one right here in the back. We don't see it quite well here. That's a medial rectus. It adducts, meaning it moves the eyeball towards the midline of the body and helps in medial rotation of the eyeball. Next we have lateral rectus, as shown here. This big muscle is lateral rectus. It abducts the eyeball, meaning it moves the eyeball away from the midline of the body and helps in lateral rotation of the eyeball. Then we have superior oblique. Oblique is at an angle, and the superior oblique rotates the eyeball inferiorly and laterally. I want to highlight these. Remember, the superior oblique moves the eyeball inferiorly and laterally. And then we have the inferior oblique, which is this one right here. And this muscle rotates the eyeball superiorly and laterally. So inferior moves the eyeball superiorly and laterally, and superior oblique moves the eyeball inferiorly and laterally. The end.